And we've been covering the situation at Yakima Valley Memorial Hospital a lot over the past couple of weeks, but things are getting worse. The hospital now pulling back on non-emergent surgeries and outpatient services so they can focus on emergencies. KVU's Emily Goodell spoke with the chief medical officer about the crisis they're facing and what the hospital's doing to try and make it through. Emily.
Local healthcare workers are burned out, stressed and frustrated. Hospital officials say they don't know if people understand exactly how bad the situation is right now and how much worse it could get. Right now, doctors are at the point where they're struggling to find places to put patients and struggling to find the personnel to treat them.
On Thursday night, there were 37 people in the ER waiting to be seen by a doctor.
Those are people we don't even know what's wrong with them. They could be having a heart attack out there and you'd never know it.
When they finally got back, it wasn't to an exam room because patients are sleeping there while they wait for a regular bed to open up.
They were seeing patients not only in hallway stretchers, but they literally just brought in just plain chairs and actually had ER patients sitting in chairs in the hallway and seeing them there.
At the same time, a patient with a serious medical condition came to the hospital by ambulance and they couldn't find a bed.
They had to just manage them right there on the paramedic stretcher and then move them into the hospital. These are really dangerous situations, and this is not how we want to care for patients.
Now the hospital is taking drastic measures to deal with the crisis.
We are stopping all non-emergent surgeries. So any surgical case that will require admission to the hospital unless it's absolutely necessary.
They're pulling nurses from administrative duties and shutting down some outpatient services so those staff members can care for patients.
We're also looking for opportunities to consolidate services, moving some services that we provide on site and consolidating them as outpatient settings so we can free up more space and staff internally.
They don't know how many employees are fully vaccinated at this point or how many they may lose if they don't meet the October 18 deadline set by the governor's vaccination mandate.
We're starting to get a little bit of an idea, but we aren't going to know probably until October 4th or so.
Hospital officials say without the community's help, it will only get worse from here.
That mask is to protect other people from you. So when you choose not to wear that mask, you're not saying I'm taking a personal risk that I might get COVID by not wearing the mask. You're saying I don't care about the people around me and I'm going to subject them to the risk of me being around them.
The hospital is still working to figure out exactly which of those outpatient services will be affected. We'll continue to follow up and we'll of course have it here for you when we learn more. Reporting live from our Yakima studio, Emily Goodell, KVU Local News.